Good evening. My PowerPoint presentation topic is Are males more vulnerable to getting and dying of COVID 19 than females? Presented by Ada Benite for Nursing Research, and my professor is Dr. Jill. The background. COVID-19 pandemic is the current healthcare problem that is ravaging our healthcare system, and it's hampering unhealthy lifestyles with underlying health complications. Our particular aspect of focus is gender differences in COVID 19 patients with a focus on severity. The COVID 19 virus is spreading quickly throughout the world. In just a few months, over 200 territories and nations have reported cases, leading to an infection rate of 167.32 million persons worldwide. And this was stated by the UN Women 2020. The current death toll of COVID 19 is at 3,473,034 people. The purpose of my study. The current state of affairs indicates that about 9 million people who are males are infected with COVID 19, while about 8 million people, which is about 49.1% females, are infected with this disease called COVID 19. This has raised the concern whether males are more vulnerable to getting and dying from COVID 19. The general topic of study is COVID 19, and the specific focus is examining the gender difference in COVID 19 patients with a focus on severity. Thus, the study will focus on examining the gender difference in COVID 19 patients with focus on severity. My research question is: Are males more vulnerable to getting and dying of COVID 19 than females? My methods. I'm going to use design and procedure. The best research design for this study is the mixed method. This study will use a case study research design to generate an in-depth and multifaceted understanding of COVID 19 severity between male and females. This is conducted through the use of observations, interviews, and analysis of secondary and primary sources of information regarding COVID 19 severity. In the present study, we systematically explored the prognostic value of the clinical factors, which include gender, age, and comorbidities, in 189 COVID 19 patients from Wuhan, China. My design sample setting. Both qualitative and quantitative data are crucial to provide adequate answers to the research question. The researcher will extract the needed data or information from a public data set of patients who have died of COVID 19, a case series of hospitalized COVID 19 patients who are currently receiving treatments, and patients who have survived COVID 19. This data will be analyzed in terms of gender. Results. We discovered that the gender, age, and comorbidities are associated with the survival of COVID 19 patients by performing the Kaplan Meier curve analysis. Compared with the female patients, male patients have a lower survival rate. Similarly, the older patients and those with more comorbidities also tend to have an unfavorable survival outcome. Continuation of my results. In addition, further stratified analysis of COVID 19 patients according to the three risk factors indicated that some laboratory indications, including CRP, IL 6, and lymphocytes, showed significant trends in gender, age, and comorbidities groups. Together, these results may provide a certain reference value for the prevention and treatment of COVID-19. For my discussion, a systematic exploration of the prognosis of such clinical factors such as age, comorbidities, and gender in COVID-19 patients was done. Gender has been considered as a significant factor for COVID-19. Additionally, the male COVID-19 patients have a lower survival rate than female COVID-19 patients, reiterating that there is gender difference in COVID-19 severity. This significantly addresses the concern that males are more vulnerable to getting and dying of COVID-19, which has led to this present study. In conclusion, the concern of whether males are more vulnerable to getting and dying of COVID-19 is what has informed my present study. This information seeks to address this concern. According to numerous sources, men make a majority of patients with severe symptoms of COVID-19, which is a clear indication that there is a gender difference in COVID-19 patients when it comes to the severity of the disease. And here are my references. And thank you for listening. If you have any questions, please feel free to leave me a comment on our discussion for the week. Thank you and good luck.